Matt Strong here. I am just really tired of so much misinformation that's going around. So, Matt Strong's not my real name. I've interviewed thousands of dentists and many, many patients. I have formed some controversial opinions you deserve to hear, and I'm anonymous because I am really, really well known with dentists. You're going to hear things that are not the dentist's views. And I'm paid by the dentist, but they have no influence over my opinion. So see a dentist, don't listen to me. What we're going to talk about today is the truth about bleaching as I see it. Is it safe? What's it cost? How long does it last? Right? You've seen all these famous people. Some of them have really white teeth, and some of them have ultra white teeth, and some of them have, teeth that are a bit white. And bleaching and whitening is $1 billion business. But what's the real truth about it all? Let me just explain something about teeth, okay? There's really three main parts of the teeth you should be aware of. There's the living matter inside the tooth, okay? This is where the blood vessels and nerves are. Then there's a surrounding part, which is the dentin, which is really the tooth structure, and over that is the enamel, which is one of the hardest substances known in the human body, if not the hardest. That's what's in a tooth. So when you're bleaching this thing, man, you're dyeing it. And things that can affect teeth and make them yellow are things like wine, tea, some things that you drink. Also, smoking will turn those teeth yellow and stain them. Medications. If you're really young, you might have gotten tetracycline, which is a bad thing when you're really growing and your bones are forming. It can stain your teeth. And then there's just old age that can cause your teeth to look kind of yellow and stained. Now, what a dentist will do is they'll use the Vita Shade Guide here to look at your teeth and identify the shade of your teeth. And then what they'll do is they'll help you get your teeth whitened to a different shade. So they'll talk about so many shades of whitening that they can achieve through the whitening process. Now, the types of whitening that you can get at home to do whitening or at the office include whitening strips, which is used generally at home. There's a version of whitening strips that's sold in the markets and the drugstore, and then there's a more professional, strong version the dentist can sell. There's also professional trays that are made by a dentist, but they're used at home. You put the whitening stuff in there and you wear those trays. There's more concentrated formulations with the trays, so they're the same trays, but it's done in the dental office because the whitening formulation is stronger. And there's very fancy whitening systems that are used by the dentist in the dental office that use these lights or lasers along with the bleach. So what's the story on those? First of all, the white strips, Crest white strips, they're apparently pretty good. I don't have a lot of experience with them. You can try them out. There's also the very fancy whitening systems that dentists use, like Bright Smile, that use the lights, and there's also Zoom whitening, which also use these lights. And we're going to talk about that and some potential pitfalls in a moment. Is one better than the other? Well, all whitening uses the same ingredient. They don't use bleach, but they do use hydrogen peroxide or carbamide peroxide. Basically, they all use the same thing. And it depends on how strong the solution is. 10%, 15%, 20%. Actually, now some products that you can use at home are even up to 30%, which a few years ago you could only get in the dentist's office. The only difference is concentration of how much peroxide there is. And the higher the concentration, the faster it works, the shorter the shelf life, so it doesn't last as long in the bottle, and the more irritating it can be to your teeth and gums. Now, problems with whitening include a temporary tooth irritation. It can be longer lasting and incredibly painful if it's not done right. It's rare, but this does happen. And gum irritation, especially if you don't get the professionally made trays. You don't want the bleach coming in contact with the gums. To minimize problems, avoid overnight treatments. Don't do anything where you stick something in your mouth overnight. It's not a good idea. Avoid treatments at the dentist that might heat up the tooth. There's some evidence that can really be a problem. The CRA, Clinical Research Associates, is extremely well known amongst dentists, and their research has showed little difference between treatments that use light and laser and the treatments that use just the bleach. Now, some dentists will say that, hey, the light and laser works better. However, the evidence isn't necessarily there. So The one thing I would say is use professionally made trays, because that will ensure that there's a good fit with those trays in your teeth and you're not going to get the bleach on your gums, which you don't want to do. These are what the trays look like, and these are the syringes. You generally will squirt the bleach into the trays, and then you put the tray that's been fitted by your dentist into your mouth and keep it there for 30, 45 minutes or an hour. What does it cost? Maybe $200 to $500 in a dentist's office, maybe $50 to $200 if you do it at home. It lasts about, well, let me tell you, in the office, the whitening looks really great the first hour, but there's evidence that the kind of in-office whitening with the lights looks best after it's done because of dehydration of the tooth, and it takes about a week for the tooth to rehydrate. So after about a week, you're going to get a shade that you see your teeth at, and that shade is going to stay with you at least for a while. How long will it stay with you? It depends. If you avoid coffee, tea, wine, they contain tannins that stain the teeth. If you avoid those, you could have white teeth for a long, long time. But if you don't, in about 6 months, you'll probably be halfway to getting your old shade back, and you will want to think about whitening again. So all I can tell you about bleaching and whitening, it's safe, it's simple, it's effective. I prefer the in-office trays done either at home or in the office. Personally, I wouldn't go for the laser or the light bleaching, the fancy stuff. But done right, I think it's safe. If it's not done right, it can heat up the tooth, but most of the dentists are pretty good about that now. So what if you could get your questions answered, like, can bleaching hurt your teeth? How can you buy implants intelligently? Can you fix gum problems without cutting, without knives? How can you improve your smile by 50% to 80%, really get your confidence back? And what should you know about sedation dentistry if you gag or you're very scared or haven't been to the dentist in many years? What's the truth about common dental recommendations? What if you could get dozens of your most pressing questions answered by me with honesty and integrity? I have prepared an audio CD that you can listen to many times in your car that does just that, and I'm calling it my Gold Tooth CD. All you have to do is go to goldtoothcd.com, and you can get your Gold Tooth CD. You can listen in the car. The first 200 orders will be free, no obligation whatsoever. After that, it'll be $3 for just the shipping. That's all. There's no obligation, supplies are limited, and it's not available in all areas. Your privacy is assured. Go to goldtoothcd.com and just register and get my CD mailed to you so you can get all these answers, at least the answers that I believe are right. It may not be what the dentist agrees with or other people agree with, but it's after what I believe with my research. I really hope that you get my CD. There's nothing to lose, and you're going to learn a lot that you're not going to hear anywhere else. goldtoothcd.com. And I'll speak with you soon. It's Matt Strong. Talk to you soon. Thanks. Bye-bye.